Hello, and welcome to our second video blog on dementia. I'm extremely excited to be offering these every single week with partnership with Spectramed. As we talked about last week, we went very in depth into the prevalence of dementia and why are we seeing such an increase in the numbers, and really talking about the epidemic that's really here before us. So again, my name is Dr. David Hutchings. I am a neuropathologist and specialized in the area of dementia and Alzheimer's, and I'm also the Chief Operating Officer for Spectramed. So we're very excited to be offering these video blogs. So let's get started into week two. So we did talk about the prevalence, and I get asked very often is why do we see such a big increase in the number of Alzheimer's cases and dementia cases now? And it's really not that the people are necessarily living longer. And you may think, well, that sounds crazy because people are living longer. So I'll kind of speak out two sides of my mouth here. People are living longer with chronic diseases. So we're living longer with heart disease, or we're living longer with diabetes, and some of these conditions that have detrimental impacts on health, but we're able to manage those now. So as we get to that age 80, our chances of developing some form of dementia does increase to 1 out of 2%. So again, chances are that if you don't acquire the disease, you're probably going to be taking care of somebody that does. So today, let's define dementia and then talk about what is dementia versus normal aging. I think we've all walked into a room and forget why we walk in there, but later on you'll come back and realize why you walked in the room. You may go to the grocery store and you forget a couple items. That happened to me last week. The primary reason I went to the grocery store, I forgot the 2-3 items that I needed. These things are a part of normal aging. I had somebody ask me one day, I can't remember my 4th grade teacher's name. Is this a sign that I can have a memory loss and Alzheimer's? And I said, well, when's the last time you tried to remember your 4th grade teacher's name? So if you don't use the information often, your brain is going to kind of push it off into another area and make room for more memories. So let's define dementia. And as we used the acronym before, I want to go back to that. So if we can think about the thought process of we have this umbrella term of cancer, and then you have lung cancer and brain cancer and Hopkins lymphoma and all these different types of cancer that falls under that cancer umbrella. Let's think about dementia the same way. You have this umbrella, and then you have many forms, about 85 different types of dementia that fall under that umbrella. Alzheimer's disease is a type of dementia that makes up about 70% of the cases. But dementia itself is not a specific disease. Bestly defined, it is a disease that impairs your ability to take care of yourself, but also impairs your ability to take care of others. And what we see is really 6 big characteristics in dementia. Number 1, we have an impaired intellectual functioning. Number 2, we have a loss of problem solving and some of the high level memory abilities, maybe like balancing checkbooks and these things that are very, very high level. We have a decline in emotional ability is number 3. Number 4, we have a personality change. And we'll go into that as we go into specific forms of dementia as we move through this series. We also see behavioral changes. And then number 6, we see memory loss. So I put memory loss at the last for a reason, because if we look at dementia, it impairs all mental and physical function. So it's not just impairment on memory. But if we think about dementia and think about basically the word dementia, it is actually an acronym. So the D stands for degenerative, or it can be depression or drugs related. It could be endocrine, which would be the E in dementia. So that's why we look at thyroid, we look at vitamin B12 functioning, we look at other reasons that we could be having a memory loss. The N would be nutritional neuroplasm. So if we have malnutrition, many patients will experience cognitive loss because of the malnutrition or dehydration. The T is going to be toxicity or trauma. So toxicity would be an example of maybe dementia onsetting after surgeries from the anesthesia, or chemo-related dementias. There's toxicities in the blood. Or trauma could be from some type of head injury. The I could be something from infection or inflammation. We can also have some type of infraction. So example, like a cardiovascular event, like a stroke, which would be our A. So that would be our vascular issues. And then lastly, S, we would have structural issues. So really, when we look at dementia, we're looking at all those areas. And then really trying to differentiate, is this a progressive disease that we are focusing on, or is this something that is caused by something else? And many times, I had a patient last week that we thought had Alzheimer's disease, but we found out it was something else, and it was something very fixable. So those are the cases that you're glad to see. So when we look at what is normal memory loss versus what is not normal. So what is not normal is if we forget how to do certain things that we've always known how to do, if we have frequent memory lapses, really difficulty learning new materials, or repeating or forgetting conversations or names. Some people have a hard time remembering people's names, but if this is something that becomes more often that you notice, and you're having to repeat questions and forget conversations, those are things that are not part of the normal aging processes. Indecisiveness, difficulty handling money is a big one. I see that quite often. Either paranoia with money, or inability to do your taxes, or write a check, or pay bills. These things are not normal. And then lastly, just losing track of daily events. So those are things that we would see as not a normal aging process. So as we kind of wrap up this week, what I'll say is that as we get older, I can't emphasize this as much. As we get older, it is not normal for a person to get dementia. I've had people come to me and say, oh, well, she's just getting older, she's getting that dementia. It's not a part of the normal aging process. And memory loss is not a part of the normal aging process. The brain processes up to 4 million things a minute. That's amazing to think about, a supercomputer in your brain. But as we age, the brain does begin to shrink a little bit, and it slows down in its processing. And that is why we would have some of the things that we would just see as part of normal aging. So if you forget why you walk into a room, or if you forget something at a grocery store, these things are very, very normal. The processing, think about like a computer. The processing as a computer, as it gets older, begins to slow down, and the brain is no different. Next week, we're going to be tackling a topic that I'm very excited about. We're going to talk about how we prevent dementia. Spectramed and myself also just published an article on this. There's 10 specific areas. We'll talk about how you can prevent it. I get the question all the time, if my grandma had dementia, my mom had dementia, will I get it? My mom and my dad had it. So we're going to talk about how can we prevent it, and if you do have the gene, what are your chances, and what are things that we can do to help prevent it. There's great science out there on that. We will also talk about the genetic mutations, and I'll make sure I don't get too deep in the weeds also with the genetic mutations, but I want to make sure that we understand what's happening with the mutations and what causes the brain changes. So next week we'll talk about those two topics. Very excited. Very excited to be doing the weekly blogs, and we'll make sure that we post this on our LinkedIn site and also Facebook, so we can get some more attention out there to the weekly blogs that we're very excited about. So again, my name is Dr. David Hutchings, and I'll look forward to seeing you again next week. Thank you.